Good day, I am Brion from BSN1D, and today I will perform an assessment which is the female and male genitalia. So, for today I am here with my patient, so let us assume that my patient is a live person. So, I will explain to him what we are going to do so that he will feel comfortable throughout the assessment. So, good day po sir, I am your student nurse for today. I am Nurse Hart, and today po I will perform an assessment which is the genitalia or your male genitalia assessment. Is that okay po? Okay. After that, after we are done explaining to the patient what assessment we are going to do, let's perform a hand hygiene and then let's continue with the assessment. Okay, so now that we are done with the hand hygiene, we are going to wear some gloves. Okay, now that we are done wearing our gloves, we are going to continue with the assessment. So, let's assume that this is the genitalia of my patient. So, of course, we have to make sure that our patient is comfortable and we are going to ask him. So, are you comfortable po, sir? Okay, so he just say that he is comfortable. Okay, so now we are going to inspect the penis of our client. So we are going to inspect for the pubic hair growth of our patient if there is any, and then we are going to inspect if there are any lesions or any abnormalities such as rashes, swelling throughout the shaft or the skin of the shaft of our patient's penis. So we are going to check if there are any. So let's assume that I am done inspecting the skin of the shaft and I see no abnormalities or any lesions as well as swelling, redness, there are none. After that, we are going to palpate the shaft of our patient if there are any hardened or any tendered areas. So we are going to check it, okay, and then just palpate it. So it is very important to see if there are any abnormalities within the shaft of our patient. Okay, so after that, let's assume that I don't feel any hardened or any tendered areas. So we are going to inspect now the color of the skin of the penis of our patient, the color and then the size. Okay, and then we are going to check the integrity of the patient's penis or the patient's skin. So now that we are done inspecting the foreskin of our patient, we are going to inspect now the tip or the glands of the patient. So we are going to check if there are any redness. We are going to check the size and then if there are any swelling, any lesions, such as rashes as well. So it is very important to inspect it very carefully, and we are going to ask the patient's comfortability, of course. If ever that the patient is uncircumcised, we are going to ask for help, and then we are going to ask him to retract the foreskin of his penis. So we also have to check the urinary meatus of our patient, and then we have to palpate the tip or the glands of our patient. Okay, so we just have to gently squeeze it. Okay, so we have to squeeze it, we have to palpate it for us to see the urethral discharge of our patient. So let's assume that it is normal. Okay, so now that we are done with the penis, we are going to go now to the scrotum of the patient. So now for the scrotum of the patient, we have to inspect for its size. Okay, so we have to inspect the size and then the shape. Okay, and then the location of any scrotum of the patient. So we have to check it, and then we have to check if there are any lesions as well as swelling, and then any rashes on the scrotum of the patient. So for me, I can see no abnormalities or any lesions, rashes, and all of it on the scrotum of the patient. And then now we are going to palpate the scrotum of the patient with our two fingers and then our thumb. Okay, so let's assume that I did this. Okay. Okay, so with this, we are going to palpate the epididymis and then the testes of our patient. So, okay, let's assume that I did this. Okay. So both scrotum. Okay, so now you have to note the size, the shape, and then the consistency of the scrotum of the patient. So after that, we are going now to continue with the inguinal area. Okay, so let's assume that this part is the inguinal area of my patient. So we are done with the penis and then the scrotum, now the inguinal area. So we have to inspect for any bulges of within the inguinal area of the patient. We have to palpate if there are any bulges. Okay, so we also have to check if there are any lesions or something like that. So now we are going to use our index finger and then put it on the scrotum of our patient, and then we have to press it upward. Okay, so and then after that, while we are doing it, we are going to ask the patient for him to cough. Okay, so we are going to do that so that we can know if there are any abnormalities within his inguinal area and then the scrotum of the patient. So we have to do it on the right side and on the left side of his scrotum. Okay, so now that we are done with that, we are done with the inguinal area of our patient. So now we can say that I am done with the male genitalia assessment. So you just have to say to the patient that you are done with it and that we have to thank him for his time and all. Okay, so now that we are done with the male genitalia, we are going to continue with the female genitalia. So this is the vagina of our client. So of course we have to make sure that she is comfortable within the process. So we can ask the patient, so ma'am, are you comfortable? And if she said yes, then we can continue with the assessment. So for the female genitalia, of course, we have to check for the mons pubis of the vagina of our client. So we have to check for any hair distribution. Okay, so we have to inspect it, and then of course we have to inspect the labia minora. Okay, so we have to check um, the perineal as well. So we have to check if there are any swelling or any signs of redness. Okay, so we also have to check the labia minora as well as the urethral meatus. Okay, so we have to check the vagina of the patient. Okay, so the vaginal opening of the patient. Okay, so we have to check or we have to take note of any swelling, okay, if there are any, because that is important for us to know what step should be the next thing to do. So we also have to check the clitoris of the patient's vagina. Okay, so once that we are done with all of that, we are going to palpate the Bartholin's gland of our patient, which is in this part. It helps to lubricate, okay, the vagina of the patient. So we have to palpate it and then check for any swelling as well. So we have to check for any swelling as well as the discharge of it. Okay, so we also have to check for the clitoris of the patient. So once that we are done with that, we are going to palpate now the urethra of the patient. So you have to put your fingers inside of the vaginal opening of the patient. And then once that you insert your fingers or the index fingers, we're going now to push it up and out. So by doing this, we can observe the drainage of the vagina of our patient. Okay, so that is for the external of the vagina of our patient. Now for the internal of the vagina, we are going to check now, we are going to inspect now the size and then the shape, okay, as well as the vaginal opening, the angle of the vagina. So we are going to put again our index finger with a warm water. Okay, so let me dip down. And then we are going to insert it now to inside of the vaginal opening. Okay, so now we are going to assess the vaginal musculative by keeping our index finger inside the vagina of our client. We are going to ask our client for her to squeeze around our fingers. Once that we are done with that, we can continue with the bimanual examination, in which you have to put your index finger inside, okay, the vagina of the patient, and then your non-dominant hand will be put on her abdomen. Okay, so you will have to squeeze the non-dominant hand or the abdomen of the patient, and then you will just put it, and then you will palpate, okay, and then check the different insides of the patient. So let's assume that I did that, and then once that you are done, I mean, of course you have to take off your gloves, okay, and then of course you will ask the patient's comfortability throughout the assessment. Okay, so ma'am, are you okay with your assessment? So do you feel comfortable po? Okay, so once that the client said yes, then we can now say the different results of the assessment, and then sabihin ko lang na normal po yung kanyang mga naging results sa assessment for today, and we can now say thank you for her time. So ma'am, thank you po for your time, and I hope na naging comfortable po kayo throughout the assessment, and after that, we can now leave. Thank you for watching.